Now, drug injection sites may be becoming more prevalent in New York City, which is a divisive topic among some lawmakers. One America's Midkiff has more on the controversial facilities.
New York City becomes another major city to consider creating supervised injection sites for people to use heroin and other illegal narcotics. One of those sites is a facility in Brooklyn called Vocal NY, trying to do their part in stopping the overdose crisis.
Our job is not only to keep people alive, we want to keep them healthy. We want to get them connected to services that they're able to recover not only physically but mentally and spiritually, so when they do decide to move forward, that they'll be healthy enough to do so.
Vocal NY allows people to sign up to use a monitored bathroom, where staff check in every 3 minutes on an intercom to make sure they're okay. If no response is heard, staff members will enter the room with anti-overdose medication. The organization claims that in 8 years, only a small amount of people have overdosed, but no one has died.
The reason people say that stigma kills is because the majority of people who die of an overdose, they die because they were alone. The number one reason, naloxone, the overdose reversal medication, it only works if you're with someone. So the majority of people who die, they're using alone, and the reason they're using alone is because they are not comfortable or able to tell someone what they're doing.
According to federal data, at least 47,000 people across the nation died of an overdose from 2016 to 2017. Researchers have found that these injection safe havens have led to a reduction in HIV infections, 911 calls for overdoses, and other societal problems. Back in May, New York Mayor Bill de Blasio began seeking approval to open 4, quote, overdose prevention centers for a 1-year test run. Multiple cities, including Philadelphia, San Francisco, and Seattle, are also looking into opening up drug injection sites. However, other city officials are convinced safe injection sites would enable drug addiction and the looming opioid epidemic, instead of stopping it.
You certainly have to look at those who are suffering from chronic addiction and how are we going to help those people. You have to look at preventing people from falling into that black hole too. And I think that SIFs undermine that effort.
Despite the controversy, researchers have estimated de Blasio's proposal could save the city millions of dollars in healthcare expenses and potentially prevent around 130 deaths each year. Caroline Midkiff, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.